Hi, my name is Emily Myers from Dr. I's first period AP seminar class, and this is my IWA presentation video. My research question is, what causes the lower class to avoid healthcare and medical services in the United States? There is a lack of understanding and a sense of no control regarding the pricing of healthcare in the U.S. When ill or injured people are rushed to the hospital, they are immediately treated before acknowledging the cost. This causes many individuals to experience medical debt. Many patients are treated and then are unable to pay the cost of treatment after the procedure has occurred. Price transparency could be a plausible solution to this lack of knowledge. Price transparency is the exact opposite of this problem. Patients are made aware of surgery and treatment costs ahead of time, which can allow them to prepare. There are many rules and laws that are currently being applied regarding price transparency. However, some hospitals are not compliant with these rules. For example, it was reported that only 5.6% of hospitals are complied with requests regarding price transparency and publish the documents. There is a sense of secrecy when it comes to healthcare pricing. The United States has significantly higher healthcare prices than the rest of the world. The cost of healthcare in the United States is increasing, which is adding to the difficulty of reducing medical care prices. If doctors and healthcare professionals fail to be honest with their patients and do not give them exact costs, then it is extremely difficult for consumers to make important healthcare decisions. As individuals experience more medical conditions, they are more likely to avoid receiving treatments if they are unaware of the costs or sense a stealthiness among their healthcare providers. To further support this idea, Wendy Netter Epstein describes a real-world situation. A 65-year-old patient was told he needed an angioplasty. Before receiving the bill, James had no idea how much the procedure would cost. He did not know that an angioplasty surgery at another hospital in the same city would have cost only $10,749, which is $500, which is 532% less. This type of scenario is common in the United States. Price transparency documents must be published so that procedure costs are the same among different hospitals and patients do not have to worry that they are receiving help at an expensive hospital versus a cheap one. Since prices are so high in the United States, there is a high percentage of people skipping out on vital care. Different areas in the United States have more expensive healthcare when compared to other states. For example, the states with the next highest percentages of people not adhering to doctor's orders are Indiana, 38%, Texas and Utah, 36%, Missouri and Alabama, 35%. This quote is referring to states with high healthcare costs. Patients are more likely to avoid healthcare if the prices are extremely high because spending large sums of money typically makes individuals uncomfortable. The number of times Americans visit the doctor is much lower than other countries. This is most likely because the high costs prevent individuals from being able to afford medical help. Price transparency and positive effects. Price transparency is when healthcare professionals let their patients know the total cost of all treatments and services before they occur. Price transparency could lower the cost of healthcare if it is enforced properly. This is because hospitals would all have the same or more similar prices, and it is more likely that the prices would decrease at the expensive hospitals versus increasing at the cheaper ones. Knowing the cost of vital treatments can help consumers shop around for a price that is best for them. Price transparency documents can allow patients to prepare for medical costs ahead of them and can also help individuals save money for surgeries, medications, and more. Even if hospitals were only to publish the prices for half of their surgeries, it would still make it more plausible for the cost of healthcare to be decreased. Negative effects of price transparency. Price transparency can cause consumers to collude or feel like they need to compete with others to find the best price. More specifically, consumers should not have to look around or search for the lowest price. Prices should be given to consumers to make them feel safer when going into treatment and care. The more info that patients are given regarding the procedures they must receive, the more comfortable they might be when the day comes to be treated. Here are some solutions. Price transparency lets patients know the cost of all treatments and procedures beforehand, and consumers can examine the costs of these services at different locations and compare them. It will also allow them to check if their medical provider is overcharging them. Having a more shoppable experience regarding medical procedures can put patients in a more familiar environment, which can make them feel more comfortable committing to a treatment. Financial programs could be created that are geared to help healthcare patients understand costs ahead of time based on price transparency documents. More mobile clinics would also be a possible solution because they can help people who are afraid to go into a doctor's office. For example, patients who are fearful of COVID-19 could call a mobile clinic in order to receive a checkup or prescribed medication if they do not feel comfortable being exposed to the disease in an office. Here are some limitations to these solutions. One limitation of price transparency is that many hospitals do not comply with the requests to publish price transparency documents. This can make it more difficult for people to commit to a procedure if they are not aware of the price. Financial aid has a similar limitation. Because of the low percentage of people that are compliant with the price transparency rules, we cannot form these financial programs. And finally, mobile clinics cannot help people with major illnesses who need treatment or surgeries. Thank you.